Hello everyone, I'm Dr. Aaron, and I want to thank you for coming today to our Regenerative Medicine and Stem Cell Education Seminar. I want to say right from the beginning that this presentation is for education only, and all therapy is performed by the licensed medical providers required by the state that you live in. The reason I'm up here sharing regenerative medicine and stem cell therapy with you is because I had an issue years ago with my shoulder, an injury that would just not heal. I had tried everything conservative that I could think of: physical therapy, rehab, pool therapy. I had 3 cortisone shots in less than 8 months. Nothing worked and nothing was helping, and I really didn't know what to do next. And fortunately, I found out about regenerative medicine and stem cell therapy, and I had a lot of questions about it. Probably the same questions that you all have. And I want to make sure that we get those answered for you tonight, because when you look online or look up stem cell therapy or regenerative medicine, you'll see all sorts of opinions on it, right? You'll see people that think it's the greatest thing ever, and it's helped thousands and thousands of people. You'll find people that say, I just don't know enough about it yet. And then you'll get critics that say, I really don't like stem cell therapy. What you need to do is look at regenerative medicine and stem cell therapy and figure out for yourself, is this the best option for you? And is this something that you want to try? I can tell you for myself, I've been pain-free for over 3 years, and I struggled for almost a year not being able to lift weights. I couldn't sleep on my left side. I had pain shooting from my shoulder down into my hand and up into my neck. And I really didn't know what else I was going to do. And we've done therapy on over 21,000 people, and the success rate is extremely high. These are the questions that you probably have, and we want to make sure we answer these for you tonight so you can determine if regenerative medicine and stem cell therapy is the right decision for you. We want to answer, what are stem cells? How do they work? Are they safe? Will they work for you? How long will it take? And how much does it cost? These are the main questions people have, and we want to provide those answers for you tonight. Before we get into the rest of the class, there's a very important concept that you must understand about regenerative medicine, and this is the concept of how it actually works. And that is that your body's constantly regenerating. How many people here have heard that your body constantly regenerates? Like most of you here, right? We know that our bodies are constantly healing and regenerating, and science has proven that. Just some examples. Your stomach cells regenerate every 5 days. Your skin cells, your epidermis, every 7 to 10 days, which is why you lose a tan so fast when you come back from vacation. Those skin cells are regenerating and repairing. Your red blood cells regenerate every 4 months. Your liver cells about every 5 months, and your skeletal system, your bone, about every 10 years. So our body's constantly regenerating. Science has proven that. But that leads to another question is, if it's constantly regenerating, then why don't we heal from chronic injuries or acute injuries that we have? Bulging discs, sprains and strains, ligament tears, ligament injury, osteoarthritic degeneration, loss of cartilage space. We know the body is regenerating, so why doesn't it regenerate from these type of injuries, or why can it take a long time? And the answer is it has a lot to do with the quality and quantity of the stem cells in your body. When you're born, 1 in 10,000 cells is a mesenchymal stem cell. By the time you're a teenager, it's 1 in 100,000 cells. By the time you're middle-aged, around 40, only 1 in 250,000 cells is a mesenchymal stem cell. By the time you're 60, it's nearly 1 in 400,000. And by the time you're 80 or 90, it's 1 mesenchymal stem cell for every 2 million cells. So as you can see, when we're born, we have a lot of stem cells. And that makes sense because our bodies are growing and healing and regenerating at a very rapid rate. And as we age, those stem cell counts drop. That's why when you were young, you could sleep on the floor with no pillow, ride your bike to your friend's house, up hills both ways, do it again the very next day, and wake up and still feel great because you had a lot of stem cells and your body was regenerating very quickly. Now I have people coming in that are in their 40s or 50s that have worked in their garden for a few hours and they're sore for days because the rate at which their body regenerates is a lot slower because they have fewer stem cells. So that's a very important point to remember. When you're born, you have a lot of stem cells. As you age, that number of stem cells in your body drastically declines. You have a lot less of them. And the quality of the stem cells change as you age. They're not as healthy as they were when you were younger. So let's look at what a stem cell is. There's actually a standard set by the International Society of Cellular Therapy of what a stem cell, mesenchymal stem cell specifically, should be. And that must express certain markers, it must stay a stem cell in a culture, but most importantly, it must differentiate. So let's take a look at what that means. What does it mean for a stem cell to differentiate? It means that it must make or become different in the process of growth or development. which I like to replace growth or development with regeneration. So really that stem cell is a blank slate. It hasn't become anything yet, and depending on where the body needs it, it can be programmed to go to that area of the body and do what the body needs it to do. For example, it can become another stem cell. It can differentiate and help go to areas of cartilage and tissue for repair. It can become fat, which helps protect joints and organs. It can become bone. It can become muscle. It can fight apoptosis, which means it can inhibit cell death in the body, and it can fight inflammation. I like to explain a stem cell like an Army Corps of Engineer coordinator. If there's a natural disaster, let's say there's a hurricane and a whole town gets decimated, you have the Army Corps of Engineers that goes in. Somebody fixes the power lines. Somebody fixes the roads. Somebody cleans water. Somebody provides medical care. That's what stem cells do. They take the chaos of an injury in the body and know exactly what to do and help and heal and repair that specific tissue in the body because they can differentiate, which means become like or make new in different tissues. That's a very awesome thing about stem cell therapy. Here's a little explanation again about how stem cell therapy works. When we're born, our body's relatively healthy. We've had very few injuries, not much wear and tear. But as we get older, we have falls. We work on hard floors in a factory or turn one way all day. We have car accidents. We've played sports. Your body starts to break down, which is why you have stem cells. And what stem cells do is provide the building blocks and the support and the scaffolding and the growth factors, which is a complicated words, but really what that means is the stem cells allow those injured tissues to repair and regenerate. Repair and regenerate, which leads to normal, healthy function again. That's what stem cells do. Let's look at the different types of stem cells that you can get here in the United States. There are three main types of stem cells that are available. You have the umbilical cord matrix, which comes from the donated umbilical cord from healthy babies and healthy mothers. No baby, no mother is harmed. It's actually from the donated cord tissue. You have bone marrow aspirate, which is where they'll go into your own bone, typically your iliac crest on your hip, and go in and drill out and pull out bone marrow. The third is they'll do lipoaspirate, which is they'll go in and pull some fat out of your body, spin it down, and try to isolate these stem cells. So these are the options that I looked at for myself, and these are the options that we looked at for our patients across the country when we wanted to determine what type of stem cell were we going to use and why. Which one of these is the best option? And this graph really shows it. So again, here we have the umbilical cord tissue, which is what is from the donated umbilical cord. We have the bone marrow in the middle and the adipose tissue on the right, on the far end. And if you look at the umbilical cord matrix, that is the only one that has every box checked because it has all the growth factors and cytokines and scaffolding along with those very important mesenchymal stem cells. And what's unique about this is the younger the adult stem cell, the healthier and more viable it is. So think about this. If you're 80 years old, would you rather have 80-year-old stem cells in your body to try to help it regenerate and repair? As we looked at early on, only 1 in 2 million of your cells is a mesenchymal stem cell at that point. Or would you rather have it from the healthy tissue from a healthy baby and a healthy mother where the cells are 1 in 10 million? The replication and the viability is much stronger. In looking at doing regenerative medicine, we wanted to offer the product that contained everything, not some of the products, not some of the good stuff, but all of the good stuff, which is why we chose the umbilical cord matrix or the Wharton's jelly tissue. Is stem cell therapy safe? It is absolutely safe. There are more than 4,000 clinical trials going on right now, which you can check out at clinicaltrials.gov. Many of these trials are showing very successful outcomes for people with low back pain, neck pain, shoulder pain, elbow pain, wrist pain, neuropathy. All the aches and pains that many of you are suffering with are trying to get answers for, just like I was for my shoulder. They're also doing studies on many neurodegenerative conditions because, as we explained earlier, every process in the body requires regeneration, and stem cells are the factor that lets that regeneration happen. So most people agree stem cell therapy and regenerative medicine is the future of medicine. I wanted to review again where we get our regenerative medicine products and our stem cell products because safety, quality, and viability is extremely important. We have 4 approved labs that meet the FDA standards that our healthcare attorneys have said are good quality labs. These labs have all been visited by the FDA and have no action needed in their labs and follow all the guidelines for disease and serology testing required by the FDA. So what happens is a healthy mother has a healthy baby. That umbilical cord is donated, collected, cleaned, tested, and processed into regenerative medicine products. It is then put in cryo storage in liquid nitrogen where it can stay viable for up to 125 plus years. A sample is then tested as the product is quarantined. After testing for disease and serology comes back clean, that product is then released and it is shipped to offices around the country that use these in patients to provide regenerative medicine and stem cell therapy services. The products are extremely high in quality, extremely safe, extremely effective, and extremely viable. And that is absolutely important when you're looking at stem cell therapy, is the quality of the product. And we will not cut corners on the quality of products that we utilize for our patients. Let's answer some more questions that we didn't get to in the main part of the program. Is stem cell therapy FDA approved? Stem cell therapy is still considered experimental. The FDA does regulate how stem cells are utilized and what the laboratories must undergo in the processing of the stem cell product, but it is still considered experimental. How long will your results last? For my shoulder, I don't expect to ever have stem cell therapy again unless I have another fall or an injury. It's been over 3 years and it is 100%. These therapies are extremely effective and are there for the long term. What they do not do is reverse the aging process. So if you have another fall or if you have another injury, you may need a booster down the road, and that is something that we look at individually, case by case, and we can handle those questions with you separately after reviewing if you're a candidate for regenerative medicine and stem cell therapy. What is the cost of regenerative medicine and stem cell therapy? The cost can range between $3,500 to $10,000. And again, this is depending on you specifically and your specific needs, which we can discuss with you in consults to make sure we're getting exactly the right amount of product for you. Does insurance cover stem cell therapy and regenerative medicine? At this time, insurance does not cover it, although many HSAs and flex spending accounts are providing reimbursement for regenerative medicine and stem cell therapy. Again, that is something we can look at and discuss with you as we're seeing if you are even a candidate for regenerative medicine and stem cell therapy. Are there any side effects? The only side effects are soreness around the injection site. Sometimes people feel like they have a mild fever for a day or two. Very, very rare. Again, we've done over 21,000 therapies, and mainly it's just some soreness at the injection site, which usually goes away in a day or two. We covered how many treatments are needed. Ideally just one, depending on your specific condition and what your goals are. You may need a booster along the way, which we can talk about with you in the consult once reviewing your history. How is success determined? This is a very important part of the process. Success is determined by your goals. If you're 80 years old and you want to have stem cell therapy in your knees and regenerative medicine to be able to dunk a basketball, that's probably not realistic. But if you want to have less pain, more mobility, be able to be more active, those are good goals. Success is really determined on finding out what your goals are and making sure they fall within what regenerative medicine and stem cell therapy may be able to provide for you. Why should you not consider stem cell therapy or regenerative medicine? Two main reasons are usually what we run into. One is the cost, and second is if you want a 100% sure thing. We can never guarantee that it's going to 100% work for you. The cost is something that we can work with. We have financing options available. We want to make sure that regenerative medicine stem cell therapy, if you qualify, is affordable for you and that the cost is not going to keep you from having therapy. And we are happy to do a phone consultation, have you come into the office, no charge, to discuss your specific needs and if stem cell therapy and regenerative medicine is right for you. Thank you so much. If you have any other questions, please let us know. You can do so by the link below. Thank you so much. Have a great night.